In a vote of 60-40, the Senate passed a procedural vote early this morning. The final vote now expected on Christmas Eve. Here now with his reaction to the vote, Senator Bob Corker, a member of the Banking Committee. Good morning, Senator.
Good morning. Short night, gentlemen and ladies.
Yeah. Hey, last time we were talking, you said 10 or 20% that it didn't happen, I think. And then I remember saying, so you're telling me it's 80 or 90% that this happens. Is it 95% that it happens now?
Well, there's no doubt from the standpoint of passage, last night's vote was very important. We still have two more procedural votes. I mean, in fairness, it's hard to see what would derail it coming out of the Senate. And then the question is, does the House say, well, in essence, you know, we don't matter anymore. Whatever the Senate passes is what we'll take. So there's still some play there after, in fact, if this bill does leave the Senate, which, let's face it, it looks like it does, there's still some things in play and some moving parts. But you'd have to say that for those who want to pass a health care bill that's full of trickery and budget gimmicks and is going to add tremendously to our budget deficit, for those who wanted to see that happen, last night was a big night.
Okay, so is there a reason to make it? You don't want to work Christmas Eve, do you? I mean, is there a reason to take it there if it's going to happen anyway?
You know, we're going to have a meeting today at lunch with our Republican colleagues to sort of talk about this. There's still the issue of the debt ceiling that hasn't been dealt with. It has to be dealt with, it's my understanding, by January the 4th. So there are still other issues, and I think all of us, especially with the stimulus bill, with this irresponsible piece of legislation as it relates to our fiscal affairs in this country being dealt with this way. There are many of us that are very concerned about our indebtedness, the fact that we're just kicking the can down the road, and so there are other pieces of legislation still at play. So we'll see. You know, I think all of us believe this is an incredibly important piece of legislation, and my guess is that, well, we'll know after lunch today what's going to happen.
All right. I mean, the public option is out of it. The public option is out of it, and the far left, the progressives, the liberals, really, really hate the bill. Isn't there some stuff to like here, Senator?
Yeah, I think anytime you have a bill that's over 2,000 pages with a 380-page amendment coming after that, there are some components of this bill that are good. There's no question, but it's the core of the bill.
Which is what?
I think
covering 30 million people that don't have it, and the pre-existing conditions, some of those things most people want to do, right?
Well, some of those are good, but I think you got to remember that half of the people that have been added through Medicaid, which is probably the worst health care program in our country. 40% of physicians won't see Medicaid recipients, 50% of specialists. But it's the financing that is most problematic. We've got basically $500 billion that's being taken out of Medicare, which is insolvent, and being used to leverage a whole new entitlement without even dealing with the doc fix. This amendment actually took out the 1-year pay for the doc fix. So now we have a $285 billion liability that's not being dealt with. So again, a lot of budget gimmickry. This no doubt is leaving our country in worst fiscal conditions. So certainly there's some good things in this bill, some things that I like, the exchanges, the issue of pre-existing conditions. I support those. What I don't support is building a new entitlement off an entitlement that's already insolvent and basically kicking future generations under the bus. I think that's wrong. I don't think y'all would rate many companies on your program who did this kind of thing in a very good light, and certainly I think this is bad for our country.
Senator, the Journal points out today that there are all kinds of special deals that were cut, and of course this happens in any legislation, but Ben Nelson holding up until he wins the concession that Congress will pay for 100% of Nebraska's Medicaid expansions in perpetuity. It probably makes other states wonder, wait a second, how do we get a deal like that? You considering voting for the bill so that you could do something like that for Tennessee?
Good idea.
Well, you know,
there
were all kinds of discussions last night on the floor, and you know, people saying, boy, you could really get a lot done. Maybe the Center for Disease Control being established in Tennessee, but I say that in jest. Look, this is, I think most people in Tennessee and people around this country are wondering why they should pay for a special deal for Nebraska just to receive one vote. And I really was uplifted by the comments of the governor of Nebraska, who said right after the deal was made that regardless, this is bad for Nebraska, it's bad for our country, and I think it's bad for the political process. I mean, this really makes sausage making. It gives it a bad name. When you look at the kind of things that really have happened over this last week, the fact that a 380-page amendment came out, we had 1 day to look at it. We're still pulling out tidbits, if you will, of that amendment, and we voted on it last night. I mean, this whole process, unfortunately, must leave Americans with less faith in what we do here in Washington.
Well, Senator,
if that's possible.
It has been 8 months in the making, right? We've watched this painfully go through committee. I mean, it's not like Democrats unveiled a bill out of thin air. I mean, there has been some work that's gotten done over the past 8 months.
Well, let me say this. There has been some work done, but very early on, I sent a letter to the majority leader telling him that if we used Medicare money to leverage a new entitlement, we had 36 Republican senators sign it, we could not support a bill. So on the very front end of this, months and months ago, there was no way to actually reach a bipartisan consensus because we were leveraging a new entitlement with one that's insolvent. So look, the process you say, look, this bill was actually mostly written in the last couple of weeks behind closed doors. So you say, yeah, there's been a lot of discussions, but the fine print really wasn't put in place until the last couple of weeks behind closed doors. I don't think that's a good process. And the fact that every single Democrat voted for it and not a single Republican, we don't do big things in our country well when one party writes the entire bill, which is what happened here.
You said real quickly that we'd have a better idea after lunch about what the next process is. Why is that? What happens at lunch?
Well, I know we're going to be meeting today as a group on the Republican side to look at how we go forward. Right now, it's certainly planned out to be here on Christmas Eve. My guess is most people will want to stay until Christmas Eve. We still have the issue of the debt ceiling, as I mentioned, to deal with. It hasn't been done, so we'll just have to see. Sometimes the two leaders get together and make other arrangements. That's a little bit above my pay grade this morning, but we'll see how this plays out. No doubt last night was a step forward for those who want to see health care reform done in this manner. I'd like to see it done too. I'd like to see it done in a way that creates tremendous competition and transparency and at the same time doesn't throw future generations under the bus. This bill doesn't meet that test, and I'm disappointed, but we'll see where we go from here.
I mean, you could get Graceland, it could be declared a national treasure. There's a lot you could do with something that's going to pass anyway. I don't know why you just don't think about the people of Tennessee and try and get something for yourself, Senator.
Well, I think all those deals have been probably cut. It's that 60th. It's that 60th vote that gets the treasure chest, as you know.
You're right. You're worth nothing. We don't need you. You don't.
61 doesn't.
I don't think the people of Tennessee would be very proud of me if I tried to do that.
It'd be bipartisan. At least they could say it's bipartisan. That's worth something, right?
I don't think so. I think people in our state understand what's happened.
Grand Ole Opry. I'm thinking it says a lot of things that, anyway.
I think they'd rather see us do it in a different way or not do it at all. So I thank y'all very much. I hope you have a good day. We look forward to talking to you again soon.
Thanks. We do too, Senator. We appreciate it. And we did reach out to Democratic leadership on this issue, and no one was able to join us at this time. We did have John Harwood, but he's the only one that agreed today.
Well, it was,
Go ahead, Senator.
I came from the business world like you guys, where you have to get up in the morning and go to work, and I'm always glad to be with you.
Yeah, and we appreciate that.
Thank you.
I know most of your colleagues are sleeping in today, probably. Anyway, see you later.
Long night.
Thank you.
Never had jobs.
Still to come this morning, we'll get some top stories. It's been a big year for tech, with the NASDAQ outperforming the other major averages. Will that be more